a young patient comes see you with the darkness of breath, the first thing is you need to do history to find the occupation, to rule out the cancer and all that stuff. Then do the examination, and if there are little finding, then you go for the serum electrolytes as well as the chest X-ray. The moment you see the increase in the calcium level greater than 10, you suspect it's a sarcoidosis. Why? Because vitamin D is converted by the macrophages of the lung into the calcium, okay? And then on a chest X-ray, what are you going to find? You're going to find bilateral lymphadenopathy, like the hilar lymphadenopathy, and there's going to be a reticular opacities into the upper lobe as well. So you know this is a sarcoidosis, but we have like sarcoidosis is a restrictive disease. That means it the granulomas is going to give like the stream of the lungs. So you have the decreased in a DCLO. So we have the decrease in a DCLO. And since the restrictive disease because of the granulomas, so this is going to be decreased because it is increased in a obstructive disease. Since it is a restrictive disease, it will be decreased. So decreased and decreased. This is the only option, and this is like the plus minus. Like the ratio would be increased. Right? So this is this option. Okay, so what happens? We have DCL. If we have obstructive disease, we have restrictive disease. In obstructive disease, COPD, this would be less, and it would be increased in asthma. In restrictive disease, if there's like the pathology of the lung, then it's going to be decreased. If there is a pathology of mutating, or the BMI is induced, or the obesity hyperventilating syndrome, that might be increased. And if we had like the hemorrhage, there's going to be an increase in a blood into the alveoli or anywhere else. So increased blood means increased exchange of the carbon dioxide. That means DCLO would also be increased in case of the hemorrhage. So where it was increased in asthma and COPD, in restrictive disease it was decreased in our lung pathology, and it is increased hemorrhage. So you don't have to remember, it's just a common sense. So this is your answer.